2014, there was a reported 166 people in America infected with Salmonella. The most common strain of it is Salmonella cauthum, and symptoms include fever, diarrhea, and abdominal pain. Sometimes it can even lead to hospitalizations. Recent investigations suggest that direct contact with bearded dragons caused the disease. Salmonella cauthum, as I said, was the main source of infection. However, more recently, there have been findings of Salmonella caserae found from a sample of culture in bearded dragons. So, the current situation, the CDC has collaborated with multiple organizations, one being PulseNet, and they received DNA fingerprints of Salmonella bacteria through diagnostic testing and pulse field gel electrophoresis. The other organization they worked with is NARMS, and they conduct antibiotic resistance testing. With these organizations, they found that there was a strong correlation between bearded dragon exposure and Salmonella infections. So the investigation is over, and it was very successful. The correlation was proven. However, reptiles continue to be a cause of Salmonella infections in the U.S., and this is something that will always happen. So with that, we must educate people on this issue. We must educate, in particular, reptile owners, veterinarians, store owners, and healthcare providers on proper care and cleanliness and the health risks that come with exposure to bearded dragons. So step 3. Prioritizing core issue. In February 21st, 2012, 166 people were infected with Salmonella. January 22nd, 2014, Wisconsin notified the CDC of Salmonella infections related to exposure of pet reptiles, and they had 12 people with the disease, reported with the disease. So after that, the CDC began investigating the issue, and of course, they then found that there was a link between bearded dragon exposure and Salmonella infections. So with that, again, prioritizing education. Education is very important. We must educate reptile owners, veterinarians, healthcare practitioners, and pet store owners on the risks and proper care of reptiles. So, using the health belief model, I created 2 different approaches that I thought would be beneficial in combating the problem. Since education is a top priority when analyzing the issue, I thought that requiring pet store owners to provide a reptile care sheet upon purchasing a pet would be super beneficial. And this sheet would include topics such as washing your hands, safe handling of reptiles, and cleaning up properly after and when handling reptiles, and extra precaution that must come with children's exposure to bearded dragons. It can also include health risks that come with exposure to reptiles, such as Salmonella. Also, statistics of Salmonella cases and outbreaks would be cool. And it must ultimately just emphasize ways to prevent this infection from happening. Another approach could be the development of strict procedures that health providers should follow when discussing pet care with their patients. Health providers should be knowledgeable in this case and be able to explain the health risks that come with reptile exposure. Here is a poster the CDC has created that lists the health risks and proper care that comes with reptile exposure and owning a reptile. So, some recommendations, given that education is of top priority, is just educating store owners, reptile store owners, and their customers. One recommendation is, of course, as I said earlier, handing out a reptile care sheet. Another recommendation is to post posters, such as the one I just showed, near registers and next to reptile cages. And then my last recommendation would be to educate store owners on health hazards and Salmonella cases so that they can relay the information to their customers properly and most efficiently. The action plan would be for store owners to be involved in this effort by being required to provide reptile care sheets to their customers. So by 2019, the CDC should have a reptile care sheet drafted, and a year later, it should be approved by the government. By 2025, store owners will have care sheets at their stores ready to pass out, and posters should be provided as well. And then by 2030, all reptile owners should be aware of the health risks that come with owning a reptile. In my opinion, I believe that this is a serious issue that should be addressed before it gets worse, because not many people are aware of it. Growing up, I've owned a leopard gecko and a turtle, and I didn't know that they could transmit salmonella to me. So I think that educating others and spreading the word will really help in the prevention of spreading this particular disease, and serve as a really strong attempt in eradicating this issue. I really think that providing reptile care sheets after purchase of a pet will be a super successful step in attempting to stop this disease.